Thank you very much for coming along this afternoon, especially as I'm imagining for almost everyone, it's lovely and warm and sunny outside. So very much appreciate you taking the time to come and listen to our spiel. This is the second of our new webinar series that we have titled kind of In Conversations With, and it's some work we're doing as part of ENRICH Scotland to try and make sure that we have more conversations about what work is going on with researchers and with other people who may benefit from that research. So today we are focusing our conversation, somewhat strangely as the person introducing it, on Rich Voices and the work that myself and Denise do with people living and working in care homes. So what I'm going to do to get us started is just to ask the speakers today to introduce themselves. Then I'm going to tell you a bit about Rich Voices, who we are and what we've been up to, before handing over to Denise. So firstly, can I come to Claire and ask you to introduce yourself, please, Claire?
Thanks, Rosie, and good afternoon, everybody. So I'm Claire Stevens, and I'm a kind of relative newcomer to Rich Voices and ENRICH, really. But I'm here, I suppose, because my husband Kenny lives in a care home. So Kenny marked his 6-month anniversary of moving to a nursing home just at the weekend there. So my husband is 68, but he has Lewy body dementia, which has progressed sort of quite aggressively, really, in the last couple of years. So that's who I am. Thank you.
Thanks very much, Claire. And Karen, do you want to introduce yourself?
Hi there. Welcome, everyone. I am Karen Mackie and I'm a care home manager. Worked in health and social care for 30 years now. So really excited to be working here and seeing you all today.
And just to Denise, who is on mute.
That's a lovely start. I'm Denise Munro and I work with Rosie in ENRICH Scotland and also in the Neuroprogressive and Dementia network with their lived experience groups and helping increase their involvement in research.
That's a really good reminder, Denise, that I haven't actually introduced myself either. So for the purpose of people that are catching up with this as an audio or a video, I'm Rosie Ashworth and I lead ENRICH Voices and Partners in Research, so for ENRICH Scotland and for the Neuroprogressive and Dementia network. So before I get started, just to let you know, we have the chat box for if there's any questions while we're talking. We're going to give a short kind of not quite a presentation, but a little bit of information each, and then we'll open it up to questions. But if you have any in the meantime, feel free to pop those into the chat and we will come to them. So I will get started with who Rich Voices are, what we do. So Rich Voices stands for Research in Care Homes Voices, and we are the patient and public involvement group, or the equivalent of a patient and public involvement group for ENRICH Scotland. Right off the bat, we should probably say that we recognise that the term patient and public involvement group is often not really a term that sits well, particularly within health and social care. It's a term that's used a lot within healthcare, but in terms of the group we're working with, often people say, well, we're not working with patients here. That's not the appropriate term. So we're the equivalent of, and part of the reason we kind of focused on creating a group name and a group identity was really to help with some of that challenge of how do we make sure we kind of have the visibility of what we do, but without that kind of jarring nature of patient and public involvement. So we've been running now for a few years and slowly building up the work we do in supporting ENRICH Scotland. So ENRICH Scotland, for context, covers a network of care homes across Scotland. And the ethos of ENRICH and of Rich Voices is really to make sure that people have the opportunity to take part in research if they would like to. And our role is to really support care homes and people living and working in care homes to take part in research. Rich Voices almost works kind of alongside that, looking at how we can support research in its development, as well as how we can look to support people getting involved in the behind the scenes of research. as well as looking at how we can make sure that people's ideas that they see in practice, how we can support them to come to life. The group is open to anyone with an interest in care home research, but we particularly focus on people who are living in or working in care homes and family members who support residents in care homes. And today we're going to hear from people who each have a different role within that, to tell you a bit more about why they got involved. We've done quite a few different activities as we've kind of grown and developed. Primarily, we started with really trying to make sure that people had the opportunity to hear about research in care homes. And we spoke to a group that was made up of people, family members and mainly care home staff at the time, and kind of said, what would you want from Rich Voices? What would get you involved? What would be interesting for you? And early on, there was a request for things like podcasts and for accessible research information, because we know that it can be incredibly difficult when you're already dealing with a lot of workload pressure and a lot of time constraints, then having to try and stay up to date with what's going on in research. And that doesn't mean you're not interested in the research. It means that the information isn't put in a way that's easy to grab and find the key highlights of. So we've been working over the last couple of years to try different ways of making research more accessible. We started with a podcast that was co-created in terms of what the episode focuses would be, with members of Rich Voices, including people with lived experience, as well as others who are working in the area. We've then done things like a film about care home research, to let people know that it exists. And it's a 2-minute film that the different scenes of the film were planned out with Rich Voices, so that we could really make sure that it was designed with people with that lived experience in mind. And then we've been working as hard as we can to change the way we present research on our website. You may have come across it in terms of us framing it as an accessible research platform, but essentially it's how can we make sure that the research that we support and relevant research in the area is presented accessibly and in a way that people can find it and engage with it. So we've been slowly building up different ways of making research more accessible, and hopefully finding ways that people living and working in care homes and their family members want to engage with and can see that when we kind of put forward an activity that they're interested in being involved in, we try and then make sure we can follow that through and show that kind of that there's a nice clear outcome, so we can go full circle with some of these activities. I'm not going to say too much about the activities we've been doing more recently, because I'm going to hand over to Denise to do that. But that's a bit of a flavour of where we started. And I think importantly, one of our key premises is that we're aware that this is new. The patient and public involvement in care homes has not really been done. We've worked with BSc students, medical students, who looked at kind of some of the barriers to this, why it might not be happening. And we've really been trying to build from the ground up an approach that works. But there's a lot of trial and error, and we're always open to the kind of new ideas and new ways to approach things. So I'm going to hand over to Denise, who's going to talk about one of our latest ways to shape involvement.
Thanks, Rosie. So as Rosie said, for the last maybe 6 months, we've been looking at how we can engage care homes more effectively, including residents and family members who, as Rosie's already stated, their voices are crucial to research. And the way that we did this was started in December last year by Rosie, was an initiative to go out and visit family members in care homes and just connect with them. And I joined the network ENRICH in January, so I was able to join really early on from the second visit in these care homes, and it was a really lovely way to get out there and visit care homes and get to know relatives and meet residents and find out what's important to them and what involvement might look like to them. And I did these visits alongside one of ENRICH clinical studies officers, Maureen, who is great fun and engages with care homes really good. So that was also another nice bonus. And these visits often were just informal chats. One care home put on a little tea for us, afternoon tea, which was a nice bonus. And just a nice way to just gently connect with with the care home community and find out a bit more about them. But the aim overall was to build relationships with these relatives, because as we stated, their voices are vital in research, and also so are residents, and relatives are an important part of bringing residents into research and having their voices amplified. So that was the kind of overall aim of the visit. But throughout the visits, what we did was also just explain who ENRICH Scotland are and who Rich Voices are, because we're well aware that not everyone will know who that is, especially relatives and residents, and the different ways that they could get involved. So, you know, through traditional participation, you know, being a member of a participant in a research study, surveys, questionnaires, or getting involved in, and Rosie's already mentioned, patient and public involvement through Rich Voices, and being a kind of partner in research or a partner in engagement, and lots of ways that can look like feeding back to researchers on their study proposals and helping them shape them to be more effective in care homes and more reflective of what they need, and to interpret study results, hopefully more relative and more accurately, and also communicating with the care home community these research findings and raising awareness of issues. Like Rosie mentioned, we've done that recently with a podcast. And we were also able to answer any questions that they had around all these different ways of getting involved. And one thing that came up, and I think this is an important question that we hear a lot, is on data and how that's secured and used. So we were able to allay any concerns around that and just increase understanding a little bit more of how these processes work. We were also able to learn a little bit about what involvement might look like for them. You know, we're aware that family members are juggling a lot. They may be in high stress situations, and how can we shape involvement to kind of increase their ability to be involved, and what the barriers to involvement may be. And all of this has been really useful in helping us to shape our engagement with care homes. But it is just a start. This was piloted between December, as I mentioned, up until about April this year, and the local clinical studies officer, who is the local member of the ENRICH team, who will go out and support care homes and make them aware of research, they're going to continue these relationship building visits in their areas. These discussions will continue to shape how we engage with relatives and residents, and how we increase their opportunity for involvement, and how we engage with them, how we let them know about opportunities for involvement. And we're aware that, you know, the care home community is not a static community. It evolves. Many people join, some people drop off. So these discussions are important to making sure that we're continuously keeping our ear to the ground to shape our strategies for involvement, our resources for involving people. And one of the things that came out of that, which is I think a nice simple example of how little things can be important to shaping these things, is the different ways that people are engaging in getting information from their care homes, and how they might prefer to get involved, to get information. Some people prefer social media, some people prefer a mailing list, some people prefer a newsletter. So there's not really one size fits all, and if we can keep engaged with people and keep finding out how they'd like to get involved and be flexible in how we're engaging, then we can hopefully make that more suitable to residents. But as I said, this is just a start, and these relationship building family visits are going to continue in the local areas through the clinical studies officers. And I wonder actually, Claire, if that might be a nice way for you to come in and to tell us a little bit about why you think residents and family members should be involved in care home research.
Right, yes, thank you. So I mentioned my husband had just moved into his nursing home 6 months ago, but prior to that, his consultant, who's Dr. Gordon Duncan, old age consultant in Edinburgh, he'd persuaded my husband to sign up for the NHS, what's it called, the NHS sort of research network. And my husband had been able to participate in a a small piece of research before he went into the care home. So I suppose that then led to us meeting Rosie and yourself, Denise, and some other people sort of involved in ENRICH and also the Neuroprogressive and Dementia network. So I suppose by the time Kenny moved into the care home, I'd got, you know, a few sort of contacts on that front. And I suppose, I mean, on a very personal level, from Kenny's point of view, first of all, so Kenny was for 20 years what used to be called a psychiatric nurse, so a mental health nurse. These days he was a charge nurse, and had a very scientific sort of research kind of brain. So for him, research is really important. And the nature of Kenny's Lewy body dementia has meant that he's been practically voiceless for several years, insofar as he has aphasia and finds it really difficult to communicate. So there's something about my role as his partner and his advocate in trying to sort of support him to still have a voice. So, I mean, just as an example, sort of 2 weeks ago, Kenny went through the consent process to donate his brain tissue to the Alzheimer's Scotland Brain Tissue Bank at Edinburgh University. And that was such a massive thing for him to do, but an important thing, because he felt he wanted to contribute to you know, future research and for benefiting people in future with no benefit to himself whatsoever. And I suppose that's why we've both got an interest in research in care homes. And I suppose my view is that people living and working in care homes, I think, are at risk of being overlooked by most research projects, or else seen as sort of hard to reach or too difficult to involve. And I've been really impressed by what I've seen of ENRICH so far in terms of sort of flipping that round and saying, no, we're going to reach out to care homes and have a special programme that reaches out to care homes and values the involvement of people in care homes and does innovative work to reduce the barriers that care homes face. And I suppose on the same sort of theme, really, I think care homes support some of society's most vulnerable people, most of whom unaided are not going to have a voice in research. And I think especially those with dementia or other cognitive impairment. So for me, there's also something about, you know, care homes are part of our communities, and people living in care homes, and indeed those working in community in care homes, they're very much as part of a community as somebody, you know, living in their own home out with a care home. So there's something about rights for me and human rights in this, that people in care homes should have an equal right to participate in research. And also just thinking back to when I was researching care homes, it was an immensely emotional experience, really, really difficult. And I had a friend help me. But the sort of things that I was looking for in terms of a care home was a care home that would be, yes, homely and warm and inviting and seemed inclusive, but also that the staff would seem professional, but also committed to continuous improvement in terms of care and support. So although I wasn't involved directly with ENRICH at the point at which Kenny moved into the home, I think in hindsight that to me there's something about a care home wanting to be involved in research as a care home, wanting to be involved in improving life for its residents, improving life for the family members of those residents, and actually improving opportunities for its care home staff. So I think that's really important. And I don't know whether the Care Inspectorate gives points for care home involvement in research, but I think for people looking for a good care home, involvement in research, I think would be something important. And just finally, just now, I think as well, there's something about when your loved one goes into a care home, you give up a large part of your own caring role. So that's sort of, in my case, that hypervigilance and, you know, not having a minute to myself, and the sort of stress and anxiety, but as also being the only sort of person for your loved one who's sort of doing everything. And actually you have to let go of an awful lot of that when somebody goes into a care home, and you feel you're losing some of your former role. So I think for me, being able to be involved with ENRICH, and actually with some other things like the Parkinson's UK Dementia Working Group I'm involved in, and some other things in the third sector, for me it's been a way to continue to use sort of experience, lived experience, and to channel that into things which might benefit people, you know, sort of beyond my husband. So I've found it useful on that front. I've lost a large part of a particular caring role, but I'm still very much my husband's carer and supporter and advocate and champion, and I want him to have a voice, and I think his voice is important in research. So that was quite a lot, Denise. I'll stop.
No, you're fine. It's all very, very interesting. Just wanted to pass on a comment from Neil Armstrong. He says that he doesn't think, I think he's referring to the Care Home Commission accolades, but he says that he thinks most care homes would love to get involved in research more, but the harsh reality is that they don't have the time or resources often. So just when I thought, let you know that feedback there. I also wondered if I could ask you a little bit on what you think makes involvement easier or harder. I know you touched a little bit on barriers there, but I wonder if there's anything else you could say around that.
But I think that almost links into what Niall was saying about care homes being fearful about sort of time and resource, because actually I spoke to Kenny's care home manager about whether or not they were involved in ENRICH and in research, and the thing she said immediately was, well, we'd love to be, but the problem is time and resource, because staff are, you know, 100% focused on supporting residents. So and I think probably for family members as well, maybe some family members think, oh, I haven't sort of got time. But for me, I think that boils down to a bit of a myth about what is research and what sort of research we're talking about. So I think probably a lot of people think, oh, research is all about clinical trials or about data gathering and about filling out questionnaires and quite sort of dry, technical, techie stuff. And I mean, to be honest, I mean, the sort of research I'm most interested in from a sort of selfish point of view, if you like, is what you might call action research. So research that would take place in the home as part of an activity they would be doing already with residents to perhaps enhance an activity or carry out a new activity. And the research would be to actually, or indeed with family members, but the research would be about you know, testing out something new, testing out an improvement, testing out something different, and evaluating that. And that maybe is a message that then helps care homes as well as family members think, well, this is going to actually directly benefit us here and now in the home, and it's not some sort of abstract future benefit to a, you know, a sort of a population out there, and we haven't got time for this. So that's the sort of area I'm interested in, and maybe that's something ENRICH can help with, as you know, getting across the message that there's all sorts of research, and not to be scared of the word and think it's one sort of particular category of activity.
I think that was definitely useful in the care home family visits, was to talk about that. And you're right, a lot of people maybe have a narrower view of what research is and how much more accessible it is in different ways to get involved these days. I wonder if we could ask you now what drew you towards research in the first place?
And that's an interesting question. So I suppose partly it is my own background. So I retired last year. I had to retire really because Kenny's support needs had got so great that we just couldn't cope at home, even with sort of an enhanced care package. So I sort of retired from work, and I'd spent most of my working life in the third sector and in the sort of health and social care sort of side of the third sector. So I was familiar with research, particularly qualitative research, and just how important it is to have evidence if you're going to shape future policy, if you're going to shape future services, if you're going to get more resources allocated for health and social care. So on that professional sort of side of things, I was really interested. But again, I think it sort of comes back to my perception that, particularly in relation to older people and in relation to older people with cognitive impairment and with dementia, there just absolutely is not enough research. And I think within that, I think research in relation to people living in care homes as a subgroup where there's even less research. But if you look, I mean, if you look at the amount of attention research into cancer gets, for example, it's absolutely massive compared to research into conditions like dementia or indeed Parkinson's, which is what my husband was first diagnosed with. So I just feel like I want to sort of bang a drum for there being more focus. And I think research, it helps raise awareness about conditions. It should lead to concrete improvements in terms of either people's medical care or social care or sort of general support or whatever aspect of it is. So to me, it's just incredibly important. Yeah.
Thank you very much for sharing that with us, Claire. And I think that's a good time to actually bring in Karen of talking about the some of those challenges and reasons why we should do research. It would be good to have your input, Karen, in terms of what draws you towards research, but also how maybe you've addressed some of those challenges that people have raised.
So our focus here in our care home is having an open and inquisitive mind. You know, we do look at support plans. We're constantly evaluating. We're looking at what could we do, what could we do better, what could we change, or what could we do less of. And if we adapt that approach through everyday life and supporting our people, maintaining their sense of personhood and what's important to them, we can research. You know, I see that Leslie has put in the chat there that it doesn't need to be time consuming. And I kind of stumbled across my project on the back of doing a key worker exercise with my team. You know, I was talking to the staff about, well, what is key working to you? What does it look like? What is key working to our residents or those living in our communities? What does it look like for them? And one of the comments that came back from just about everyone that I consulted was communication's an issue. It's a real big issue for us, particularly in relation to family members, expectations. What do they think we do? What do we absolutely not do? Who pays for that luxury? And, you know, what frustrations do the family have that then impart into us in our day-to-day practice? So it was pretty much a stumbling across my topic. But yeah, we do need to have research.
Thank you. Do you want to tell everyone a bit more about the topic of research that you've stumbled upon in the best way, and kind of how it's grown from there?
So when you look at care home life, you know, having worked in the sector for so long, there is so much scrutiny. As we touched on earlier, there's audits, there's systems, there's processes. We know what we need to follow and we do it well. But is that just enough? So when we look at the information we have, a person is assessed and they require support. They come to a care home. How much input does social work have? How much information do they get from social work or placing bodies or family members if it's a private agreement? What expectation have they been sold and what do they think that we can provide? The person then comes to us and it's almost as if we're the personal assistant. We will provide one-to-one support, very little understanding into integrated communal living. And what things do we need to let slide? What things are important? What's the battles you need to pick at that time? So that's how I kind of came across it, where care homes do not get an easy end of the deal. And I'm sure everyone else on the chat will appreciate where we're coming from here. The scrutiny is immense, but we also focus on so many fantastic outcomes for people. And we almost need to pick our battles. Our communication is always open, we're always available, but do we always get that same communication style back? We usually don't. When you look at the information for someone potentially moving into a residential or nursing setting, there's very, very little information out there for family members or loved ones to consider. How can we make that better? That's my primary focus. It's almost as if our care staff, our support staff get fantastic training. You've got to have the values to be in it, we know that. Our residents, they've went along a journey, whether it be a physical deterioration or a cognition deterioration, they've been along a journey. You can't predict that, you can't plan for it. But as well, my main focus is no one really ever trains you how to be a relative. So what information could we give to support people looking for a service?
Thank you. And the topic that's of interest to you there, that's, I suppose, one of the ways we would like to kind of show up as Rich Voices in terms of how we can support projects that have come from that on the ground experience of this is a challenge that we are facing in terms of how do we make sure that there's a kind of managing expectations between staff and family members and that people are working in collaboration with each other. And I think one of the exciting, I'm excited about it, one of the exciting things that we're able to do as a network supporting research is to then kind of say, well, we know that this is happening at the care home that you are based at, and we know that this has been seen, and we know that there's challenges that could be overcome. And our plan in working together is to then say, well, we think it's probably happening elsewhere as well, and we think, you know, that other people may have had a similar experience, and are there things that we could do that would help with managing some of those expectations, and is there anything that we could be doing differently to make sure that people are kind of all speaking from the same page. So some of the work that we are planning to work on together is to explore this with some of the other care homes that are signed up to ENRICH, and we'll be putting out an invite to ENRICH and to the care homes that we cover for anyone who's interested in coming in and being part of this kind of working group to see what we can do differently about this, and kind of say, we've seen a project, we've seen a topic that needs more input. And actually it was really interesting this morning, we caught up before this, and Claire was saying, you know, actually this is an area that I agree really does need looked at. I don't know, Claire, if you'd like to add in anything there. I'll come to you quickly if so.
I'd love. I mean, I think this is just such a great topic, Karen, and I hope for the audience here that it's a really good example of the sort of research that certainly I think could have, you know, tangible benefits for people in care homes and their families, and be a sort of win-win for residents and care home staff and for families. So I just sort of, again, sort of alluding back to my personal situation, from day one of my husband going into the care home, I was determined I was going to be a good family member and, you know, negotiate a good relationship with staff and not interfere unduly where I shouldn't have. But trying to work all of that out was so difficult, and also at a time when things are really very emotional for you as the part, in my case, the partner of someone going into a care home. So all the time, and even now, 6 months on, I'm constantly aware of, what role am I playing? Is this a good thing to do or not to do? My husband went for a period of 2 months where he got an infection that didn't respond well at all to antibiotics or anything else, and ended up with delirium. So it was a really horrible phase. And I got more involved again in the care home because I was the only person he felt safe with. So negotiating all of that's incredibly difficult. So Kenny had his 6-month review on Monday there. So in practice, that was mainly done with me and the nurse in charge. And I ended the meeting by saying, because they were saying, is there anything we can be doing differently? And, you know, we talked about Kenny's progress and so on. But I ended the meeting by saying, is there am I doing things right? Is there anything you'd like me to do differently? So I think the piece of work you're doing, Karen, I think is really valuable. And maybe the research could show that actually family members, you know, we're stumbling about blindly some of the time, and we maybe put noses out of joint and tread on toes just because we don't know otherwise what to do, and because we've been in such a hands-on you know, sort of role prior to somebody going into the home. So it is difficult. It's difficult to sort of let go, but still be involved at an appropriate level. So I would love to be involved in this piece of research if there's scope to be involved at all. But I hope it might demonstrate to people listening that, I mean, that would just be such a useful thing, because care home managers would benefit if you've got family members who've got that sort of better understanding of, you know, what exactly it involves. You used the phrase, I can't remember what it was, I tried to write it down, but sort of communal living.
I mean, I'm loving that we already have one person signed up, so that's very exciting. The ball is now rolling, with you joining us on that one, Claire, which is excellent. And I think, as I say, it shows an example from our side. It shows an example of how this equivalent of patient and public involvement, how Rich Voices can have that range of activities, from already relatively well-established research, getting feedback from people with that lived experience to see how they can shape aspects of it, right through to actually kind of being there at the beginning of a project and saying, here's what we want to help build up with those building blocks. So I think it's very exciting to have those options, and hopefully it's another way of continuing the relationships that we know are vital to the work that we do in Rich Voices and in ENRICH Scotland. And we're really keen, as always, to make sure that researchers know that we're here, and people want to hear what research you have going on. People want to know, you know, what's happening and how they can maybe get involved and support that. I'm just aware of the time, and I've not been able to keep an eye on the chat, so I thought this might be a good time to open it up to some questions. Denise, I think you've been following the chat better than I have, so I might pass back to you.
So we've not really had many questions, but I wanted to go back. I hope you don't mind, Leslie, that I said this earlier on, when Claire was first speaking. It kind of felt more like a question, so I thought I would just save this till the end. But Leslie asked, she said you and your husband obviously already have a great understanding of research, but how do we reach the majority who may not have that background?
Do you want me to try and say something about that? I think that's quite difficult for me to answer. I think maybe that's something that you and Rosie could best answer, because you're doing that already. But no, I recognise that, and I sort of you know, when Leslie put that in the chat, I thought, gosh, yeah, of course, you know, that is true. But I suppose I just come back to this point: if you can debunk sort of myths about research, because I think it just sounds like something mysterious and technical, and it's not for me, and it's going to benefit other people, and, you know, I've got enough on my plate. Whereas I think the sort of project that, you know, Karen is getting off the ground by way of research, or indeed, I mean, thinking of the care home Kenny's in, where they do lots of activities and they're trying to improve the activities. And I keep thinking, just in relation to people with severe cognitive impairment and other sort of, you know, limiting conditions, the care home's doing some basic evaluation of individual residents, and do they participate, do they enjoy it, do they not? But to have some research around what sorts of activities work for different sorts of people, and you know what, sorry, I'm being inarticulate here, but that kind of thing that is very practical, where the outcome could be changes in the care home that aren't costing additional money. It means just a change of the way something is being done, and that families would then see that there's a direct benefit for the person they're working for, and not questionnaires and things that might be actually, you know, it's a chat over coffee, it's a group for sort of family members, or it's a, you know, it's an event, or it's something that people just see as their normal participation in going to the care home to visit their loved one. But on this particular day, there's an hour and you're doing something a bit different because it's part of the research. I mean, maybe the word research isn't a good word to use, I don't know.
Thank you, Claire. I don't know if, Karen, you wanted to come in on that same point.
I did, Rosie. So, do you know, we focus an awful lot, or historically health and social care has focused on outputs, you know, the tasks, what are we doing? Whereas I've always been a huge advocate for using your interpersonal skills well and thinking about the outcomes. What do we see? How does it make people feel? whether it's positively, negatively. And if we gather that information, we'll always go down the road of research and be able to make a difference. So we need to get away from outputs, the tasks, and get more on the outcomes and how we make people feel, or how people feel.
Thanks very much for that, Karen. I think we have a question from Neil. You've got your hand up there.
Yep. Hi, everybody. Yeah, no, it's a really interesting conversation there. Apologies, I missed a few minutes of Claire speaking there. I had to take another call. And I think it is about how it's worded, how it's presented. And as you say, I think the phrase research, there's a stereotypical view, time, effort, cost, resource, etc. And I suppose it's something in the past that has been a challenge for us, as I mentioned earlier in the chat. But I'm looking to try and open the door where possible. And it was interesting what you were saying there. It doesn't have to be something that's additional. It's more just building it into the everyday. And one of my concerns has been the perception from some providers through all the various different bits of research that have been done across various different organizations and potential duplication. And then the concerning bit is once the conclusion of the research and the reports, etc., that come out of that, effectively just ending up in a virtual filing cabinet in the government or the authorities, which is such a shame because there is some really valuable research going on out there. But maybe it's a case of that we don't necessarily have to get the government and the authorities involved. It's about the quick wins. What can we do with when we've got the experienced researchers who are either coming into the homes or supporting the homes to say, well, there's a quick win. Here's something that we're doing. We don't have to involve the bureaucracy, and then just being able to record those quick wins and then demonstrate it, and then holding that for the authorities and the care inspectorate, so it demonstrates continuous improvement. And I think you don't necessarily get extra points from the care inspectorate or the authorities for doing research as such. They're just focusing on the output and the outcomes. And I think that could be a slightly different way of rephrasing it or rebranding it. Because if we sit around waiting for the authorities and regulators and the government to actually do something meaningful, it's as we've seen across all the other areas, it's just not happened.
I think you also the point there also kind of links into something that comes up a lot with research around that feedback of making sure that if people are involved in something, that do they hear what it leads to? Do they see how being involved in something, what happened after that? And that often people feel like they can put that time and energy in, and they're not sure where it went. And something that we are trying very hard to do, and something that we request of researchers when they come through Rich Voices now, is to show us how they will be giving feedback, how they will let people know about that. But also something that we're just trialing on with a study that we're supporting at the moment. And I'm sure the clinical studies officers for ENRICH Scotland may or may not like me for this, is we're asking them to share a bit about their experience of going out and doing the study. Because as you say, those kind of wins of, well, what was it like? How did you get on? How did people find it? What worked? What didn't work? And I think these things are all going to shape what happens for the next bit of work that comes along, or the next activity. And the more we can learn as we go and share that learning and really make sure that we're building each time, I think hopefully leads to a kind of landscape where we've got much stronger relationships. People know that there are a huge range of different types of research. There's absolutely important space for clinical trials. There's also important space for the kind of more psychosocial research and looking at people's lived experience. So I think it's really important that we understand all those little bits and share that experience with each other. So thank you very much for putting in there. Claire, sorry, I realised you've got your hand up as well.
Yeah, I've only just put it up, Rosie. I was getting excited because Fiona has put something in the chat about her mother with advanced dementia getting involved in research in relation to music. I think that just so exemplifies what I've not been very articulate in trying to get across about positive benefits, but it's also made me think of a sort of a related point really, which is I suppose coming back to me talking about my husband wanting to sign up for the brain tissue bank. There's something about that giving him a sense of agency and purpose. And when he got involved in some focus group research that Rosie and one of her colleagues was doing last year, he needed immense support to get involved with that because he's aphasia. So I had to support him to get involved. But we still talk about that research, and he maybe the word research is kind of, you know, again, people think, oh, not everybody's interested in research. It was the participation of it, and it was the way it was done that made him feel important. It made him feel he could have a voice and get across things that he found particularly difficult about his condition and about the way he was supported and so on. So I think maybe the challenge is that, you know, at whatever stage of, in this case, dementia somebody is at, there are creative ways, if we put our minds to them, to actually involving them in research. So I don't know if Fiona would be willing to say anything more about that, but I would love to hear more about her particular example.
I think Fiona is willing to come in there for you, Claire. You're on mute though, Fiona, if you're, as long as you're able to unmute.
Yeah, sorry. Can you see? I don't know if you can see me, or you can, yeah, you can hear me. I'm trying to have some sunshine behind me. Yeah, I think it was lovely. Do you know, I think it was something that we as a family were a wee bit reluctant, I suppose, but actually my mum was already part of that music therapy and we'd heard about it, but we weren't able to be there when it was taking place. So to see it, and don't get me wrong, at that point my mum was probably quite advanced with her dementia, and it was, parts of it were distressing because she was singing the song "Show Me the Way to Go Home." So that was for me, like, but it was one of her favourite songs. But she was so emotional through it and so engaged that it just, and I suppose the way Nordoff Robbins done that was that they had some commentary around, you know, Mary's reaching it, you know, so that was their research part of it. So my mum didn't need to do anything. We didn't really need to do anything. Sorry, I'm getting emotional. but then the result of that was that we've got this lovely piece of footage that we've got forever, where my mum's not, you know, she's no longer with us. So yeah, I think there are lots of ways that you can kind of really engage people in that without them knowing, because that's not the right thing to do as for people. But, you know, having been informed and understanding the potential outcomes. So yeah, I completely, and just, I suppose, while I'm speaking, just to go back to what Karen was saying, and I did put a message on around, so I work as independent sector lead now with Scottish Care. So we had a meeting with some of the care home managers last week around some of the challenges with the residential care and additional supports, etc. And one of the things that they really was very strongly coming through was the engagement, just exactly what Karen was saying around that engagement with families and those, you know, I suppose it's the whole challenge of just what you said, Claire, losing that whole responsibility of caring, but also the expectations of things are just going to be the same, almost, you know, that perfect one-to-one care. And unfortunately, you know, that's not always the way in a care home, because it's not possible. And so just being able to understand that before it actually happens, I think, because lots of care home admissions take place in a crisis situation, don't they? So yeah, just so interesting. Sorry, I could talk all day. I'll stop now. Claire, you shouldn't have brought me in.
No, not at all. Thank you very much for sharing your experience, and you'd be very welcome to join the working group where we start looking at that
Love
topic.
to.
Because,
absolutely,
you know, I think it's really about bringing people's different experiences together, and some of it will be what worked well, and some of it will be what didn't. And I think so much of what we do in ENRICH Voices, but also in the wider scheme of things, is about accepting that we're not always going to get it right. We're going to make mistakes, things are going to work, things are going to not work, and we're always trying to, you know, reflect on that and say, right, what can we do differently? And I think this focus around kind of expectations of family members and staff comes from a place of how can we make it better for everybody. It's not from a place of, you know, judgment that anyone's doing it a wrong way or anything like that. I think it's about saying, you know, we know that people might be in crisis, that things might be going on, that there might be all these competing things, but are there things we can do that could potentially make it a bit easier? And I think it really resonates with why it's important to have these conversations, why it's important to bring in people with lived experience. And we have certainly found with researchers that have come through Rich Voices and through ENRICH that they're seeing the value of having the input from people with lived experience, either living or working in care homes or family members involved. So it's really great to see it evolving in that way, and being able to share that. So thank you very much for your input there. I'm going to double check that there's not any final questions, and if not, I will wrap up because I'm aware of the time that it just speeds away from us.
From Leslie, for Claire and Karen and others in the care home communities, what would encourage or discourage you from supporting research?
I was going to suggest Karen went first because I feel like I've said quite a lot and there's only a minute or two left. So Karen, do you want to go first?
Thank you, Claire. So I would always say, I would always be encouraged, you know, we always need to be inquisitive. We need to know, we need to focus and put our efforts into making change. Nothing changes, nothing changes. So let's start asking questions. I don't think there's anything that would really put me off, you know. As we'd said earlier on in the chats, it takes a lot of time. We do have an awful lot of requirements upon us for our day-to-day workloads. But I suppose in essence, we need to make time and have that focus. My focus is when I'm past my care home management days and I've moved on to something else, I just want to be able to look back and say that I've left care home life a wee bit better and I found it. So I would always be open to seeing what else is out there and what difference we can make. Cheesy as it sounds, but it needs to be the way.
Thank you, Karen. Do you want to come in there, Claire, as well?
No, just very, very quickly, I suppose. I mean, I've said quite a lot about what would encourage me, but I think a sort of, if you like, a co-production, to use a sort of jargon, co-production model where relatives, family members and residents are involved, if at all possible, in, you know, designing the study from the start or helping shape it or be involved at a very early stage. I suppose what would discourage me, and I'm just trying to think might discourage other family members, would be, you know, if it was, you know, if a researcher descended like in their helicopter on the care home and said, I'm here to carry out, you know, such and such a study, I think most people would find that off-putting. Whereas actually, if a researcher comes in and says, I'm here to talk to you about what matters to you and what sort of issues and challenges and problems, you know, could we work with you to look at, is there a way to help sort of make those better? I think that's what would encourage me. And I think what I've seen of ENRICH Voices so far, that's the approach that you guys take. So thank you for that.
Thank you very much. And I promise we didn't pay Claire to say that about us. So, you know, we'll take that lovely compliment as a way to round up today, I think, just in terms of time. But firstly, I want to say a massive thank you to Claire and Karen for the time you put into, you know, coming along to this and sharing your experiences and the research and things that you're interested in. It makes all the difference that you're not just listening to myself and Denise talk. It's really important that you hear from people who, you know, have this experience, and I think hopefully shows the sorts of work that we're doing and that we're hoping to keep doing and that we're building on over the next wee while, and that we're always very, very open to new ideas and exploring ways of supporting people living, working in, or supporting someone in a care home. If you have any questions, you are of course still able to drop us an email. It will, if you're watching this will catch up, it will come up on the screen, I believe. But you can also contact us, and we can make sure that whoever the best person to respond is gets back to you. But otherwise, I'm going to let you all go and enjoy the rest of your sunny afternoon. Thank you so much, everyone, for joining, for sharing your thoughts, and for joining us on the chat, and for coming in with your questions and things. Really, really appreciate you taking that time. And thank you very much.